Living the life.
Now we are going to go to our first guest, and we are joined by Muneeb Abu-Ghazaleh, who's the country director of Islamic Relief, and he's been working on the ground in Gaza amid the pandemic. So let's welcome him on the show. Assalamu alaikum.
Assalamu alaikum, Muneeb.
Wa rahmatullah.
How are you there in Gaza?
Alhamdulillah, we are fine. Thank you for hosting us.
Alhamdulillah, it's really, really good to have you here and to hear as well what's happening in Gaza. Now, you have a lot of experience, 7 years in the industry, 7 years in the sector, working with NGOs and as the country director as well. So tell us a little bit about what is happening in Gaza concerning COVID right now.
Yeah, actually, the first cases of COVID started showing up around the end of August. But numbers have been increasing steadily since then. The first numbers showed up around 4 cases in a certain area in Gaza, and there were some strict measures to keep it as is. But unfortunately, it broke out to different areas. The numbers now ranging from 250 to 300 per day. The total cases that we had is around 8,000 until now. Alhamdulillah, many of them have been recovering. Hospitals are having now, at the time being, around 500 cases, I guess, hospitalized. But things are still in hospitals to a big extent under control because the number of severe cases is still limited. The only problem with hospitals is that even though the numbers are limited, the COVID preparations and COVID responses within the health sector has consumed around 30% of the capacity of hospitals. This is simply because they are already undercapacitated anyways. So, you can imagine a total of 500 being treated and a total of 8,000, showed positive signs, have consumed around 30% of the capacity of health system serving around 2 million people.
Is it easy
So
for
this
the
is
people in Gaza to get a test?
the difference in numbers.
Mm-hmm. How difficult is it for them to get a COVID test there in Gaza?
It's actually done by the central labs of the Ministry of Health only, and it's only done for people that are suspected to be positive, either interacted with positive cases or showed positive signs. There is a limitation on the number of test kits available, so they are, being utilized to the best possible, with positive cases to a big extent. So that's how it's being done. That's why it's people always saying that if there are more tests, probably more cases will be showing up. But until now, this is the available capacity.
Of course, the healthcare system in Gaza is already quite weak. The infrastructure isn't as great as it could be. Before we talk about the healthcare system, I wanted to ask you a little bit. You said the first cases were in August. Of course, in the rest of the world, by August, we were in lockdown, we were panicking. But Gaza was hit a little bit later on. And most people might think this is a positive thing, which it is, of course. But give us a little bit of context of why that was in Gaza.
Well, probably... as I have said before on your channel, actually, luckily we had the closure on Gaza. So Gaza is basically totally closed for travel and moving in and out, which is basically the number of people that are being able to come in certain dates is very limited. So they were all tested at the border and taken to quarantine centers until they are, testing negative to be able to go out. So that's why it was fully controlled. The number of, the movement in and out of Gaza is almost, very limited. So it helped actually in that case.
how we've experienced lockdown for the first time in our lives here in London, here in the UK. People in Gaza, that's actually their reality. Lockdown is their reality, right? Just moving on to the healthcare system, if you could just enlighten us about what the healthcare system is like in Gaza before COVID. And, you talked a little bit about how the capacity is now 30%. How has that changed and the difference it's made because of the pandemic?
It's actually extra pressure on an already weak service, and it's an essential service, by the way. And it's just one of the most essential services everywhere in the world, especially in Gaza, because people most of people rely on free hospital services, if I may say, free governmental hospital services, rather than going to any private clinics because of the economic situation. So again, saying that around 80% of the community is aid dependent gives also an indication on how these people are also relying on the governmental health services free of charge. Now, the governmental health services, in terms of drugs, for example, and disposables, they have been on shortage of around 40 to 50% of their stockpiles of essential items for at least a couple of years. So this gives also an indication of how they can function. They are also undercapacitated labor-wise, doctors, nurses, cleaning people and things like that. Hospitals in Gaza are not offering meals for inpatients because of priorities. They prioritize other direct medical services rather than meals, which also puts extra pressure on inpatients in general.
Obviously, medical supplies are in shortage there. There's a lot going on. The hospitals are, not able to provide the healthcare that people need. But what is Islamic Relief doing out there in Gaza to help at the moment?
Well, I will give you numbers first of the shortages, and then I will tell you what we're doing. Actually, the lack within the health system. I mean, the monthly needs of the drugs is around $5 million, which covers basically essential items only. And essential items means for kidney failure persons, for cancer patients, for chronic diseases, for elderly and other chronic diseases, which is basically critical for these people to be continuing. We are trying, as Islamic Relief, we are trying our best to really look for some of the most critical cases that we can support, and try to fulfill their needs for certain periods of time. So within the COVID duration, we have supplied some COVID-related items, but most importantly, we have supplied also non-COVID related items that are also critical, such as medications for cancer patients, mainly children. We also supplied or are supplying at the time being essential medications for thalassemia patients who are in general of young age. Their medications are, if lost, they are life-threatening. So we're trying our best to fulfill these needs in the hospitals. We have also supplied some hygienic materials and disposables. These are all based on the priorities of the health system. So basically, there are priority lists that we try our best to contribute to, in partnership with others as well. We are also working on providing some essential equipments for the ICU units, because they are limited in Gaza, and as you know, they are needed for the severe COVID cases. So talking about, we have in Gaza around, I think, 80-something ventilators, which is most of them are already occupied with other cases than COVID. So, we're trying also to work on this as well. And we have some supplies going on.
I wanted to ask you a little bit about your involvement with young people, because we know you've got lots of different projects, and one of them is specifically involving young people to make a difference. Could you tell us a little bit about that one?
Yeah. We have actually a number of activities or projects that are working with youth. One of the interesting ones that I would like to talk about actually is investing in talented youth who are from vulnerable communities and vulnerable families. We have been before the COVID actually getting these youth and younger children some capacity building training on life skills. But they are really amazing. Now during COVID, because the centers are basically working on restricted working hours, or in many cases closed, they are leading us. And it's really interesting to say that they are telling us what to do and how to do it. So we are really learning from them a lot. And despite the limited facilities that they have in terms of technologies, but they are trying their best to utilize it as much as possible. So this is really interesting, and they are working on educating the community and awareness activities on protection measures and health issues that people should be aware of, especially in their different communities. So these are really very encouraging for us, actually, what they're doing.
It sounds like Islamic Relief have a really good connection.
Sorry, go ahead.
Yeah, I was just saying, it sounds like Islamic Relief really does have a very good connection with the people on the ground there in Gaza. And I guess because also, for example, you're from a business background. So how do you feel that this helps you there with the youth and helping people there in Gaza? It must be beneficial.
Yeah, it is actually. Despite the fact that the economic situation in Gaza has been suffering for a long time. Actually, COVID has really compounded the problem rather than starting it, actually. But one interesting thing about the people in Gaza is they are really kind of trained on how to cope with such difficulties in general. So being actually in direct contact with the different communities, different types of communities, whether it is innovators, entrepreneurs, business people, if available. You can see how people can really drive their way through the different difficulties and the different challenges and struggles that they see in each step of their way. So what we do is we'll do our best to really help these people to minimize the challenges and struggles that they have. Our focus is really on, if I may say, micro businesses or new startup self-employment activities that will replace the very limited number of employment opportunities that are available in Gaza. So we try our best to help young people to kind of depend on themselves for making their income as much as possible. within, again, limited.
It's really good to hear about this sort of approach because, I mean, youth unemployment is quite high around the world globally, but specifically Gaza is one of the most worst affected, I would say, when it comes to youth unemployment. And what's really nice, when you were talking about the young people leading the projects, you had a smile on your face. So it's really encouraging to see how, I can tell you're very proud of these young people who have perhaps come into the project, but now they're leading it and almost teaching you how to do things. Tell us about the other project, because you mentioned there was a couple of projects you have. So that's the one with young people. What other projects have you got going on as well?
For the time being, many of our activities are focused on humanitarian response due to the increasing need of the community, actually. One thing to talk about is that around 70,000 families have been added to the food insecure list in Gaza just due to the COVID lockdown in the last past couple of months, which is a lot for Gaza, because Gaza has already been, I mean, like when we say that 80% of the community is aid dependent, and we just added these numbers to them. And we have run actually a survey on daily wage laborers in Gaza to find out that most of them actually have been affected severely in their households due to this situation, whether it is food or psychosocial as well, which is basically affecting families in general due to the increasing pressure that they are going through. Because daily wage laborers in Gaza used to barely make secure their daily food, food needs. It's nothing more than that. So when they go through this, they have no savings to rely on, or they are so vulnerable to any shock. So that's why we are now focusing on responding to this need through providing food as well as mainly health support to families, not only to health systems, for the critical cases and the most affected and most affected cases of the COVID specifically. So that's what we are really focusing on for the time being, in addition to children and youth.
Now, it seems like obviously you are, as you said, concentrating on children and youth and obviously these innovation projects. Does that surprise you? Does the strength of the community there in Gaza surprise you? Does the innovation of the young students surprise you? How do you feel about it when, for example, they do manage to start up a business from one of the projects that you have helped them create?
Actually, to tell you the truth, it's not only young people. Even there are some older people that have really innovative ideas. One of the cases that I keep telling is an old lady from the southern area of Gaza that has started some business of distributing, hygiene items that she actually fills up in smaller cans and distributes to the community, and she's really making a living for her family out of this. She's really amazing. I mean, she's a widow, and she was relying on aid for a long time, and Islamic Relief was sponsoring her family for a while. But now she is really, to a big extent, independent, which is really, a pride to talk about such cases.
I mean, that's amazing, isn't it? I mean, just hearing these lovely stories, I mean, it's so heartwarming. And as you said, the fact that somebody a little bit older as well managed to get themselves back on their feet with your help is just shows us you don't give up. Yeah. With a little bit of help, things can get better. You know, you can get that business started. You can make a living out there in Gaza with your help. You know, alhamdulillah, that is so heartwarming.
And you mentioned something, it's the difference between just receiving aid and actually helping people to get onto their own 2 feet. And of course, that must be something that's really important for yourselves. Just tell us a little bit why that is so important, to ensure that people can be independent. Like you said, a lot of people are aid dependent. This transition from being dependent on others to actually being able to be independent and take things in their own stride.
Well, simply, if we want to empower the community to build again, or to empower the people to build their communities, then the best way is for to work on any sustainable impact activity, projects with the communities. And that's where it comes that, starting with the humanitarian aid definitely does not mean that it's the end of the line. We have to make sure that we start with this, with the aim to bring people out of poverty. People in the community in Gaza, they have a lot of energy and they have a lot of, talent as well. It's been really known for a long time that illiteracy in Gaza is the minimal probably in the Arab world, and many of the people are highly educated and in the different fields.
I'm just going to have to stop you there because
opportunities are very limited.
Sorry, we have to stop you because we are out of time. But one of the key things you said that, and I absolutely love, is the people of Gaza. They have energy and they have talent. And I love that. And I think that's a lovely way to end. And thank you so much for coming and talking to us about the people in Gaza and how the projects and how Islamic Relief are helping them. Thank you so much, Muneeb, for coming and joining us today.
Thank you.
Living the life.